Hi, everybody. My name is Michele Giddings. I am a board certified physician assistant, and I have been with Nova Plastic Surgery since 2014. And today I'm going to talk about acne, the management of acne, and how you can deal with it at home, what we can do in the office to treat your active acne, what we can do to treat any post inflammatory hyperpigmentation marks from your acne, how we can treat pitted acne scars, and some of the pitfalls that I find that a lot of my patients have been doing before they've met with me in the practice. So let's start by talking about a lot of the common things I run into with patients that they're doing at home that I think could be exacerbating their acne. A lot of times patients tend to over cleanse or try and kind of strip all the oil from their skin. And when you over cleanse or strip the oil from the skin, it ends up causing your skin to overproduce oil. And so that oil can then contribute to even worse acne breakouts. So I always tell patients it's good to use a gentle, soothing cleanser in the morning. I like SkinCeuticals. They're a medical grade skincare line. Medical grade basically means that it's been clinically tested and proven to be effective. So I like the soothing cleanser, which I had out here to show you all. And now I don't know where, oh, here it is. So this is a self-activating foam. It's soap-free, it's botanical based, so it'll kind of help calm any irritation in the skin. So typically I recommend starting with something like that in the morning rather than a harsh cleanser. The second thing I find that people do a lot is over exfoliate with a mechanical exfoliator. A mechanical exfoliator is kind of like a scrub that has some grit to it. And I think it's good to do that maybe once a week, but if you're doing that every day, and some patients are doing it twice a day, you're just really irritating the skin. I prefer a chemical exfoliator. My favorite is glycolic acid, and if you've ever seen me in the office, you know that I just talk on and on about glycolic acid. Glycolic acid helps to eat up those little dead skin cells that are on the skin surface that end up clogging your pores. It's relatively gentle. I usually recommend working up from 1 to 2 nights a week to nightly. And that's really going to help brighten the skin. It's going to help with the skin cell turnover and eat up all those little dead cells. So SkinCeuticals has a glycolic 10 Renew Overnight. It is this. It's an awesome product. I recommend this for all age groups. So it's great for teenage acne. It's good for people my age in their late 30s, early 40s that are struggling with acne, little breakouts along the chin area. And it also helps with anti-aging benefits. So I know that a lot of people struggle with acne. It's one of those things that it doesn't discriminate. It affects males, it affects females, it affects teenagers, it affects, late age patients. And I know that at one point in your life, you've probably struggled. Hi, Jen. Hi, Kristen. You guys have probably struggled with acne, whether it's a moderate, to severe chronic issue, whether it's like a big whopping pimple right before your high school reunion, which I just had my 20-year high school reunion last year, which is hard to believe. Time flies. But at some point in your life, either you or a loved one has dealt with acne, and there are a lot of things that we can do to help manage your outbreaks and help take care of those marks that are left from the acne. So the other things that patients typically don't realize that's affecting their skin is taking really hot showers or staying in the sauna. That increases sebum production, which then can cause acne. So I don't recommend prolonged hot showers. And then not cleansing your face after workouts. We're all busy going to the gym in the morning and then going to run errands. That bacteria is sitting on your face all day, and that can trigger a breakout. So I think a quick, easy way to help prevent that after the gym, if you don't have time to thoroughly cleanse your face, is to wipe down kind of with a toner. Something with a glycolic acid in it is good. I use conditioning solution. It's this. I keep it in my gym bag, and then I just spray it on a cotton ball and just do a quick swipe over my face. after I work out. This is a great tip for high school students that are doing after school sports like lacrosse, where they have the mask on their face. So if you have a teenager that's struggling with acne and they're involved in sports after school, or even PE class, if they can keep something like a toner like this with them in their bag and just do a quick swipe afterwards, that can help mitigate some of the issues that they can have with that sitting on their face until they get home from practice. Dietary factors come into play too. Certain patients are sensitive to dairy. It can increase inflammation. Caffeine, that type of thing can also irritate the skin. So I always tell patients to kind of, let's look at your diet and see if there's anything there that's causing some inflammation. Changing your pillowcase. I always recommend changing your pillowcase maybe 3 nights a week if you can do that, so that you're not sleeping on the same gross, oily pillowcase all night. That is a quick, easy way to do that for your skin if you're not changing your sheets 3 times a week. And then lastly, patients that have acne tend to want to cover it up, which I completely understand. The more layers you put on your skin with makeup, hi Carly, the worse it's going to be. So if you can avoid putting on heavy layers of like an oil-based makeup, that's going to help a lot. Cleaning your makeup brushes, I've touched on that before. That's super important to keep your makeup brushes clean at least once a week. And making sure you're consistent with whatever skincare regimen you're doing. If it's sitting on your bathroom counter, it's not going to work unless you put it on your face. So if you can find a way to incorporate whatever regimen we decide is best for you, you're going to get better results. So picking is also an issue. It is so hard. I know you want to go into the bathroom and just go crazy with anything you see in your skin. Picking is just going to increase the bacteria in the skin surface. There's bacteria under your nails. It's going to increase the risk of post-inflammatory hyperpigmentation. And that's a really big long word for that little area that will be residual. After that pimple goes away and you'll have like a little brown spot. I get them on my chin. And there's some great ways that we can help reduce the time that'll stay on your face, and I'll go through that in a second. Kristen just said that she scrubs her face clean all the time. What can I do to help whiteheads? So when you're experiencing a lot of clogged pores, like I said, the chemical exfoliation I think is better. Doing like a glycolic acid or in office peels like a lactic acid or a glycolic acid. Alpha hydroxy acids are the best to help with those pore clogging skin cells that are sitting on the skin surface. As we age, our skin doesn't turn over as rapidly. Those cells just kind of sit there. So aiding it any way that you can with like an AHA will really help that. So back to the post-inflammatory hyperpigmentation. That is a common issue I see a lot. It's pretty easy to help get rid of it faster. The most important thing I always tell patients is a vitamin C, and you've heard me talk about that over and over. Vitamin C is going to help brighten the skin. It's going to help, help from within, and it's going to help with collagen production. For my acneic patients, I always recommend Floritin. It comes in a serum and it comes in a gel. Most of my acne patients and most of my male patients prefer the gel because it's really lightweight. So that's going to be your first step in the morning after cleansing. That's really going to help prevent any post-inflammatory hyperpigmentation and help lighten any spots that you may have. Secondly, like I just said, a glycolic acid or a lactic acid, that's going to help, reveal a brighter skin complexion, and that's something that you'll want to do at night. Retinol is a great way to decrease post-inflammatory hyperpigmentation. If you're not doing retinol on the full face, which can sometimes be harsh and irritating to some patients, you can spot treat with a pea-size amount. Usually I say start 2 nights a week, like Monday and Thursday, and you can work your way up from there if your skin tolerates it. The goal is to not, have a lot of irritation, but initially when you first start, you'll have some peeling. That's what the retinol does. It's increasing those skin cells. So if you start like 2 nights a week, and it can kind of help mitigate that side effect there. So those are really some good things that will help. And then lastly, SPF is really important. So if you're not protecting your skin, those spots will end up darker and some new ones can appear. So you want to use a really good zinc-based physical sunscreen. And I really like the Physical Fusion UV Defense, and I'm sure you've all heard me talk about this one before. It's a mineral-based sunscreen. It's chemical-free, paraben-free, non-comedogenic, so it's not going to cause your pores and trigger a breakout. This one's tinted, which I really like. So my patients that have some irregularity in their skin tone, you can use this, and then it will kind of even things out without having to layer on that pore clogging makeup. So this is all I have on my skin right now, and I really think it gives you like a nice enhanced natural skin tone. It's really lightweight, it's water resistant, it's SPF 50, so that's what it looks like. It's a universal tint, so it works on pretty much every skin tone. So this is a really good one. They also have a matte version, which is also tinted, and it's oil absorbing, so it helps to absorb oil throughout the day. But this one's my favorite. So those are some things. Try not to pick, like we talked about, that picking is just gonna make things worse. Now, if you do pick and you end up with like that crusty, draining, nasty thing on your face in the morning and you have to go to work or you're about to go out, a little quick trick that I like to tell patients, if you get liquid Band-Aid, I'm not sure if you've seen that before in the little tube, little jar, it like drops if you have like a cut or something. If you have picked, wash your face, put a little bit of that liquid bandage over the pimple, and then you can apply your concealer and it'll kind of completely close off that draining, oozing area, and your makeup will sit nicely. So that's a little quick tip. So now if you're coming in the office and looking for treatments, there's some things we can do to help manage active acne. Broadband light laser is a non-ablative laser, meaning it's not treating the superficial surface of the skin, it's treating underneath at the cellular level. And with a series of about a 6-week weekly treatment, so it's a time commitment, but it definitely works. You come in once a week and we treat your skin with the BBL laser. We go through with a couple different filters. We use a blue light filter, which is going to help get rid of the acne causing bacteria. We use a yellow light filter, which is going to help with that irritation, inflammation, and a red light filter, which will help with the redness appearance of those lesions. That's a great way to help control the really bad acne breakouts. So typically I recommend like a 6-week treatment, and then we space the treatments out. Since most of the time acne can be a chronic condition, we're not going to completely get rid of it with a 6-week treatment, so we try and space them out. Additionally, the BBL helps with skin integrity, so the skin composition will be better. It'll be, thicker, it'll help kind of fill in those areas. So BBL is a great option, and there's no downtime with that. So you can put on makeup if you have to right after. There's no like healing time. You can go right back to work. I have patients that come do BBL during their lunch break. It helps with that post-inflammatory hyperpigmentation. It really does help with a lot of issues with the skin. The second treatment that we can do in the office to help with active acne breakouts are chemical peels. So I talked about the overnight glycolic treatment, this one. So this is safe to do at night. It doesn't need to be neutralized. So we put it on the skin, you can sleep with it, and it will help with those skin cells turning over and the brightness of the skin. But in the office, we can do something a little bit stronger, a peel that will need to be neutralized with like a lactic acid or a glycolic acid. And our master esthetician, Andrea, performs those for us. And then lastly, if those things aren't working, we have a dermatology PA who has almost a decade of experience, Morgan Klein, and we can work with her to prescribe you something orally, something topically, and work with you to figure out a plan that's going to be best to manage your acne. And she participates with a variety of commercial insurances as well. So she is an integral part to managing acne in our office. So the next thing that I'm going to talk about is pitted acne scars. That is a very common complaint patients come in with. Maybe their acne is now controlled and they're left with those little hills and valleys throughout the cheek area is the most common. So I always talk about why an acne scar looks pitted. So it's kind of like a cup. And then there's a cord underneath the skin that is like a tether that pulls that cup down, which is why you get kind of like a divot in the skin. To have an effective treatment with a laser, I really feel like you need to detether those cords. So perfractional laser is an ablative laser that goes through with microscopic little holes through the skin, and it detethers those cords. So it cuts that cord so the tissue can come back up to the level that it should be. And then that micro injury to the tissue will help stimulate collagen production so it can fill from the top down. If you don't detether that cord with something that's going down into the level of the skin, you can kind of get improvement by filling it in from the superficial surface. But if you don't get rid of that little cord that's pulling the tissue down, it's not as effective. So perfractional laser is I think the gold standard, what I would recommend for pitted acne scars. It does require some downtime. Now, right now is a great time. A lot of people are working from home. So I've had a lot of inquiries about once we get in the office, if we can start with those treatments. And it's suitable for many skin types, but you do have to expect some downtime, typically about 5 days. You'll leave the office looking a little bit scary, but you'll be happy in the long run with the results. And that's not an immediate result. It'll take about 6 months to see the full impact of that treatment. If you're not looking to do something that aggressive, microneedling is also an option. That's going to give you some microscopic skin injury. We use Skin Pen. It's an FDA-approved device to treat acne scars. So it's also doing little micro injury to the tissue. It's not going quite as deep as the laser. With laser, usually 1 to 2 treatments will give us a great reaction response, aesthetic outcome. With microneedling, I always tell my acne patients to expect at least 6 treatments to get there. So there's less downtime, but you do have to come in for more treatments. So that is sometimes better for certain patients. Typically, if you come in on a Friday, you'll be fine to go back to work by Monday looking relatively normal. I usually say no makeup for 24 hours after microneedling because we want those little microscopic injuries to heal before we put anything on there. So Jody just asked, would microneedling help with acne scars? It definitely does. Typically, when I'm talking to a patient about anti-aging microneedling, it's about 3 sessions. When we're talking about a pitted acne scar, it's going to be more like 5 to 6 sessions. Everyone's a little different. The younger you are, usually the more collagen production we can invoke by doing these treatments. But I usually say err on the side of caution and expect at least 6 treatments. Those treatments are typically done every 4 weeks. If you can get on a little regimen like that, I think that's more beneficial. And then, like we talked about, chemical peels, they are helpful. However, they're not going to really address the pitted part of the scar. They'll really more help with the pigmented areas. So those are 3 in-office treatments that we can do to help control active acne and help kind of mitigate the pitted lesions that are in the skin. So it's kind of a difficult thing. Everyone's a little bit different. So if you have any specific questions about your skin type that you want me to address, you can always email me. And the question that is asked next is, do you recommend any vitamin A after microneedling, and how soon, if so? So I do, vitamin A is great. When I'm in the microneedling treatment series, I usually tell you to hold off because we don't want to irritate the skin when we're in there doing the microneedling. So once we've completed your treatment series, if you wait, 2 to 3 weeks, you can resume the vitamin A. Vitamin C, I want you to continue throughout, but any type of retinol, we don't want to aggravate the skin right after because we've done like a micro injury to the tissue. So you want to kind of hold off on that. I'm going to show you a few other products. You want to make sure that you have hydration like we talked about. You don't want to over dry your skin because you'll in turn have more oil production. This Hydrating B5 gel is great. It's oil-free, it's lightweight, it's a gel. It has hyaluronic acid in it as well. I'm like at the end of my jar here, but let me see if I can show you. So it looks like, I don't know if you can see that. It's really lightweight, it's a gel. I do recommend this after microneedling, this or HA intensifier. This will hydrate and protect the skin, but a lot of my acneic patients like this to use as a moisturizer rather than like a cream-based moisturizer. So that's really nice. Blemish and age defense. This is my little travel sample vial I use in my gym bag. This is a salicylic acid based treatment, and that can be used twice a day to help manage any active breakouts. Discoloration defense. This is also a serum that helps to treat post-inflammatory hyperpigmentation. It's a combination of fruit acids that you can apply in those areas that you're prone to acne, and it'll help kind of prevent you from getting that post-inflammatory hyperpigmentation and lighten up any areas of hyperpigmentation. So that's a good one. Retinol, the vitamin A. So I use 0.3% retinol because I have super sensitive skin. I use this 1 to 2 times a week because I love glycolic. I feel like my skin does much better with glycolic, but I do like the properties of vitamin A. This is what I was talking about earlier for spot treatment for PIH, or you can use this even as a spot treatment on an active acne lesion. And I touched on earlier about using a gentle cleanser in the morning, and then at night I like a little bit more of a medicated treatment cleanser. So glycolic cleanser, this once again has glycolic acid in it. So this is going to help increase the skin cell turnover and help get rid of those dead skin cells. They also have LHA cleanser, which I typically recommend for patients that really have more of the moderate to severe acne or the teenage patients. And so that is also a cleanser that SkinCeuticals carries that I think is really beneficial. And then at night, you can do this clarifying clay mask. This helps to detoxify your skin. I sometimes use it as a spot treatment. If I've got like a big zit, I'll pop it on and sleep with it. And then lastly, you want to kind of soothe your skin, even if you have acne. So the phytocorrective mask, it's a botanical mask that's calming, and this I also like to sleep in. So if your skin's irritated, maybe it's peeling from your retinol, if you put a little bit of this on your face at night before you go to bed, kind of the final layer of whatever skincare routine that we've figured out for you, that'll help kind of calm everything down. So I really like that mask as well. So there are a bunch of products. It can be overwhelming. The takeaway would be make sure you're doing a vitamin C and make sure you're doing an SPF. Those 2 things are super important. And just don't strip your skin. You don't want to be crazy with your skin. If you have a big event coming up and you get a really big pimple that you just need to go away, we can do a Kenalog injection, which is a localized steroid injection into that area. There's risk involved with that, as with anything, but it does kind of help shrink that pimple. Like if you're getting married in a week or so, it'll help kind of bring that pimple down. So that's a quick in-office treatment too for big acne lesions. So if you have any questions or anything I missed today and you want to go over it with me, you can always email me, Michele with 1L at novaplasticsurgery.com. We can do a virtual consultation where I can see your skin. Morgan Klein, our dermatology PA, is available for consultations as well. And like I said, she participates with a variety of commercial insurances. But at the end of the day, if you are doing something on a regular basis, you're taking care of your skin, we can definitely get you in a place where, you feel more comfortable. So, does anyone else have any questions? No? Okay, well, thank you guys for tuning in. I want to thank all of our patients for being so supportive during this time of closure, those that have visited our online store. So all the products I talked about today are available on our online store, novaplasticsurgerystore.com. And, shopping local and supporting us has been a huge thing during this time. And if you are interested in any of the products, you can enter Michele30, Michele with 1L 30 at checkout, and you'll get an additional 5% discount. We offer curbside pickup and complimentary shipping on purchases over $150. But like I said, all the virtual consultations are complimentary. So please reach out if you have any questions. And I can't wait to see you guys all back in the office. Stay safe, and I'll see you guys later. Bye.